Hi there, I'm James Sherwood, the Director of Healthcare Management for Bupa UK Insurance. In the past few months, we've seen independent healthcare services open up and establish new ways to deliver care safely in a post-COVID world. We're now seeing a catch-up in cases that have been delayed or deferred over the past 6 months, as more patients are entering the healthcare system. But the second wave of COVID is here, and a new national lockdown has recently been introduced. So what does this mean for our customers? I'm going to talk about how the healthcare system is now better prepared for a second wave and the outlook for private services over the coming month. Whilst the NHS was under huge pressure in the first wave of the crisis, hospitals coped without having to make extensive use of the extra capacity from the Nightingale hospitals and the independent sector. Since then, lots of changes have been introduced and the healthcare system is now much better prepared. Hospitals have the PPE they need, more ventilators are available, rigorous patient and staff testing programs have been introduced, and hospitals have now established COVID-secure pathways to keep traditional services safe and open. An understanding of the virus has also improved, enabling more effective management and treatment of patients. So the healthcare system is undoubtedly better prepared for this second wave. Plus, the government has taken action to control the spread of the virus much earlier in the cycle. Tiered restrictions were introduced in early October and a new national lockdown was introduced on the 5th of November. In the introduction of the new national lockdown, the number of daily hospital COVID admissions were running at roughly half the level there were in the first wave. And the number of patients in hospital with COVID were roughly 20% lower than at the same point in the first wave. Now, there are regional differences, with some regions, particularly in the north, more badly affected. But overall, across the UK, action is being taken much sooner to slow the spread of the virus. We're already seeing a slowing in the rate of new cases and hospital admissions, and this is really encouraging. Assuming the social distancing measures are effective, I am cautiously optimistic that services in both the NHS and in the independent sector will be less affected this time around. Now, whilst the healthcare system is better prepared for a second wave of COVID, we must recognise that the disruption to other healthcare services over the past 6 months has had major consequences. The NHS waiting list of elective procedures is estimated to have doubled. There is a backlog in national screening programmes and diagnosis of conditions such as cancer for many patients has been missed or delayed. The NHS released the London hospitals from the contract in August, so they have been able to provide a full private service since then. The contract with the independent hospitals outside of London is in place until the end of this year. This means that until that point, hospitals have roughly 25% of their normal weekday capacity, plus evenings and weekends to see private patients, with the rest of the time reserved for NHS cases if they need it. Under the contract with the NHS, if an NHS trust cancels its elective services, it is then able to access all of the local independent hospitals' capacity. Now, this has happened in Birmingham, Nottingham, South Yorkshire and West Yorkshire, and that's impacted services at 13 independent hospitals. And we expect Manchester to follow imminently. Now, it's important to note that the NHS is determined to try and keep elective services going. At this point, the 13 hospitals are expecting to continue to provide private elective care whilst they also pick up more NHS activity. Also, they're not expecting a return to the blanket restrictions to just urgent services that we saw in the first wave. Also, at this point, there is no indication that NHS will seek to extend the current contract with the independent hospitals beyond the end of this year. The NHS has commenced a national tendering process to secure support from independent hospitals from the 1st of January 2021 onwards. Now, this is focusing on tackling the backlog in the NHS, but it will be on a different basis to the current arrangements. Hospitals will be able to opt in and to determine the nature and level of NHS support they provide. I do anticipate that this will lead to many independent hospitals treating higher numbers of NHS patients over the coming years. This is a good thing. Prior to COVID, many independent hospitals had the capacity to care for more patients. So taking on more NHS work will not only help reduce the NHS backlog, it will also improve efficiency and help offset some of the cost pressures from the enhanced infection protection and safety measures introduced since COVID. More NHS work in the independent sector will not erode the value of private healthcare. Our customers will continue to have much faster access to care and access to a broader range of services, such as out-of-licence drugs that are not funded in the NHS. Whilst customers may be sitting next to an NHS-funded patient in an independent hospital, they will have greatly benefited from private healthcare. Well, currently, customers have good access to healthcare services, and even the 13 hospitals that I mentioned earlier continue to run elective services for private customers. Now, we've also been seeing the signs of a catch-up in care journeys that have been delayed or deferred in previous months. Now, that has slowed in the past couple of weeks. So in terms of service availability, almost all hospitals have confirmed their service status with us, and 85% are offering a full range of services. Further 11% are accepting non-urgent referrals with some limitations. This is mainly NHS facilities that are having to prioritise existing backlogs. The majority of consultants have also confirmed their service status with us, and 98% are accepting new private patients. Wait times have extended a little bit. The average time from outpatient consultation to treatment increased from roughly 21 days pre-COVID to roughly 25 days more recently. But when compared to the waiting times in the NHS, this is really excellent. And now, independent hospitals are also advising they do not have a material backlog in scheduling treatment, and we're not seeing an increase in complaints from customers regarding speed of access. So overall, service availability looks really good. In terms of actual activity levels, well, we use pre-auth rates for new care journeys as a key lead indicator of demand. And pre-auths for new journeys have been running above prior year levels since the start of August, resulting in a higher than normal number of customers entering the healthcare system. Now, this has dropped off a little bit since the start of November. Now, it's interesting that this drop-off we've also seen in all regions, not just in the northern regions that have been mostly affected. So this appears to be driven more by customer behaviour than service availability. But we'll be continuing to monitor this trend over the coming weeks. Finally, focusing on demand for remote services. Well, use of our direct access services in MSK, cancer and mental health recovered quite quickly, reaching prior year levels in June. And they're currently running at roughly 20% above prior year levels. Use of our digital GP service provided through Babylon continues to rise month on month. And we rolled out that service to all customers at the start of the COVID crisis, and usage has roughly doubled since then. And the take of our new remote dermatology and cardiac diagnostic pathways have been really impressive over the past month. So in summary, right now, despite the new lockdown and the developing second wave, customers continue to have good access to private healthcare services. The government has taken action much earlier in the cycle, and it appears to already be slowing the spread of the virus, which is encouraging. So, whilst I know it's dangerous to make predictions, I'm cautiously optimistic that elective services for private customers will continue to be available during the next wave of COVID.